Hello everyone, my name is Dr. Joel Rosen and I'm here with a lovely patient of mine, Freda, who has given me permission to talk to you today about some of the successful outcomes she's been experiencing as a result of coming to our office for a thyroid problem. She initially responded to a thyroid recovery workshop that we were hosting, and since then she's become a successful patient. And I just wanted to discuss a little bit of the success that she's been experiencing. So let's talk a little bit about some of the things that you've been experiencing in way of successful outcomes since becoming a patient of ours.
Okay. I would say, to me, the three most important things that have happened since I've started here is that I think way more clearly. I have better recall, better intention. I have a lot more energy. I could barely move when I came. Now I want to go exercise and dance.
Now you're dancing.
Now I'm dancing.
Right.
I can't stop. And I've lost some pounds. So
great. And that's one of the things I've talked about earlier too, is that it's really difficult for thyroid patients to lose weight, and they try very hard. No matter how much they exercise or don't exercise or eat or don't eat, it's one of the main sticking points. So one of the things that we had in our program was having to remove certain foods. Discuss that a little bit, how that was for you.
Well, when I came here initially, and I still am, on a diet that eliminated dairy, gluten, and sugar. When I came here, I was eating sugar like crazy. I had a rash all over my body, and now I don't eat any of them. I miss them sometimes. I barely cheat. And I feel much better, and my rash has gone away, which makes me thrilled.
Right, and it's worth it. I mean, it's not easy.
It's it's a way of life. There's things you want to eat, but what's the trade-off?
Did you have any fears before beginning with us? Any concerns or objections or insurance? If someone has insurance and we do some of the brain-based exercises in the office, that may cover it, may not. But for the most part, there is going to be a little bit of an investment. Did you have any concerns as to whether or not this is going to work, or is it worth it, or anything along the lines of that?
Of course, one always has concerns.
Right.
It's an investment, but it's an investment in yourself. And if you don't have yourself, the rest of your life cannot possibly build around it.
Right.
And I am in a few transitions in my life, and I needed to be at the top of my game and want to be at the top of my game.
Right.
So everything I have to do for it is worth it.
What would you say to someone who is on the fence that doesn't know if they should do it or not?
Do it.
Do it. It's as easy as that. How about...
There is no question in my mind.
Right.
Do it. Whether you have the same results as I do, you will have results. You will feel better. You will want to work towards being better.
Right. And
your life will be better.
It's invaluable. You can't really put a price tag on
There
that.
is no price tag.
Right, and you're happier, and thinking clearly, that's pretty important. I know we have you doing some exercises that aren't always the easiest, but at the end of the day, you can noticeably see that you're more sharp on the ball, or focused and clear-minded.
Yes, well, due to circumstances beyond my control, I've had to reinvent myself, and that's not easy, and particularly real estate has always been my game, and to have to be in real estate and learn all the new programs and the computer and everything that you have to do with it.
Right.
I
just
got Medicare, to give you an idea of my age. So
right.
To do that at my age is not easy,
right.
and it really took a clear head.
Right, and you need to have that day in, day out.
Day in, day out.
Right. As far as our staff goes, I know you mentioned how happy you were on that. Can you tell whoever's watching this what you feel about our staff and how great they are?
I love the staff.
Right.
I love Dr. Rosen. I love David. I love Sid. Everyone is always wanting to be helpful. Everyone is caring and loving and concerned. I couldn't say more.
Great. Well, great. Thank you so much for doing this. And
no, thank you for making me
we
feel
have
better.
a hug on camera?
Yes.
Perfect. Awesome. Perfect. And so hopefully we'll be able to help you in your quest to get better for thyroid recovery. Perfect.